I'm going to walk you through a little bit on blood pressure. Now, we talked about blood pressure in lab. We all took a blood pressure. So we're going to spend a couple of minutes kind of walking through blood pressure, what it means, what the different numbers relate to. So remember, a blood pressure is basically the pressure that you get inside your vessels from the blood, okay? And it is truly from the pumping action of the heart. That's what's moving the blood. There's also resistance involved, and that's the blood moving through those vessels. And so we have what's called a systemic pressure. Systemic pressure is going to be highest in the aorta, right where that blood is getting pumped out of that left ventricle. And it's going to decline as it moves. So remember that drawing where blood is leaving the left side of the heart, going to your body's tissues, okay, and then spent blood is going to come back to the right side of your heart. This is our systemic circuit right here. And I told you that pressure is 120, right, where it is leaving that left ventricle through the aorta. Pressure is going to decline as it moves out into your capillaries and then back to the heart through veins. And by the time it gets back into that right atrium, the pressure is down to 0, okay? So it's highest in the aorta, and it's lowest when it's dumping back into that right atrium. Now remember, when we look at this pressure, it starts in those big arteries like the aorta at 120, and by the time it gets into your capillary beds, we're down to about 35. On the other end of capillary beds, it's about 14 or 17. And then 0 back in that right atrium. So what we say is that the steepest drop in pressure is happening through the arteries, okay? So leaving the aorta and that blood traveling into those capillary beds. So all through the arteries is where we're gonna find the steepest drop in pressure. Now, as long as you have a blood pressure, blood will continue to flow back to the heart, okay? The pressure gradient is helping to drive blood flow through the body. This is one of the reasons why massive blood loss can result in death, okay? If you lose a lot of blood volume, your pressure is going to go down. Think of a water balloon. If you have less water in that balloon, there's less pressure in the balloon, right? So if there is less pressure here to start with, let's say the pressure is 80 instead of 120. That means there's less pressure here at the capillary beds. That's where you're trying to get the oxygen out into your tissues. And if your pressure is not high enough, you're not going to perfuse your tissues. You're not going to get nutrients into your tissues. So this is why maintaining a high enough blood pressure is so important. So as long as you have a blood pressure, as long as you keep that gradient, you're going to keep moving your blood. So this is what a blood pressure looks like if we were to chart it out. So let's start down here on the bottom. We're going to look at this x-axis, right? So we're starting here at the aorta. So remember, the systemic pressure at the aorta is way up here. It's at 120, right? And I told you that the steepest drop is going to happen in the arteries, right? So through the aorta, the arteries, and into those arterioles. And you can see what's happening to the pressure through there. So it drops a lot. Remember, 120 down to about 35. As it moves into those capillaries, it's going to drop some as well. And then through the veins, it's much lower, much less pressure, which is why we talked about earlier in this chapter, the structural differences between arteries and veins. Remember, the tunica media, that middle layer in an artery, is really thick because there's a lot of pressure here. Whereas the tunica media in veins is much smaller because you don't have as much pressure. Now, I also want to look at this picture and talk a little bit about when you're looking at the artery. So if we're looking here in red, I want you to notice what's happening to the pressure, right? It's 80, 120, 80, 120. Oops. It's going up and down and up and down. And so we say that the pressure is pulsatile during that time. So near the heart, near the aorta, blood pressure is pulsatile. It goes from 80 to 120. And this has to do with the contraction of the ventricle and the relaxation of the ventricle. When it contracts and it's pushing the blood out, we're up at 120. When it's relaxing the pressure will drop down to 80. So every time that left ventricle contracts, pressure in the aorta is 120. As it relaxes, it drops to 80. 120, 80. So it's pulsatile. And so we say those two numbers, you know, normal blood pressure is 120 over 80. And remember those terms, 120 is what's called the systolic pressure. You have seen that term before, right? When we looked at the cardiac cycle, systolic means contraction. Remember, systole is a contraction. So systolic pressure 120 is when the ventricle is contracted. Diastolic, again, you've seen that term before. Diastole means relaxation. So when the ventricle relaxes, the pressure drops to 80. So those two terms, when we talk about blood pressure of 120 over 80, we say it's a systolic over diastolic pressure. Now you should be able to relate to those terms. Contraction over relaxation. The pulse pressure is just the difference between those two numbers. And this is what you feel when you feel a pulse. You're feeling a throbbing of those arteries as the pressure changes. Now remember that I told you as the blood moves through the arteries, we start at 120 at the aorta, but then that blood pressure is going to drop way off and it'll drop down to about 35 at the arterial end of the capillary bed. And at the venous end, it's 17. So that pressure is much lower in the capillaries. You want a low pressure in your capillary beds. Because remember when we talked about capillaries don't have all three layers, all three of those tunics within them. Remember, like arteries and veins have a tunica intima and a tunica media and a tunica externa. Capillaries just have that tunica intima. That's it. They don't have all three layers. They can't withstand a ton of pressure. They have one little layer so that we can diffuse things in and out of the capillaries, so that we can get oxygen and nutrients from your capillary out into your tissues, and we can bring the waste back in. You want a thin little layer. So anytime your blood pressure is high, it can actually destroy and damage those thin-walled capillaries. Again, they have a thin wall so that they can be really permeable. So you want a lower pressure. You don't want a super high blood pressure. And then again, on the way back to the heart, blood's going to travel through veins, and veins have a much lower pressure. So the pressure gradient is from about 17 to 0. So it's a much lower pressure. And it's a low pressure because there's a lot of resistance. Remember, your blood is now flowing basically against gravity. A lot of that pressure, but blood pressure gets lost as friction, as heat, as it's moving back towards the heart. Now, because the pressure in your veins is so low, it's anywhere from like 17 to 0. It's a really low pressure getting that blood back to the heart. There are a couple of things that we find in the veins that help to get the blood back to the heart. So one thing is muscular pumps. So you have veins that are deeper, and then you have some that are more superficial. Any veins that are deeper, that are kind of sandwiched between your muscles, what that means is that as you move your muscles, the movement of those muscles is actually helping to milk the blood and get it back towards the heart. So that's actually helping to get it where it needs to go. This is also why people who, remember we talked about varicose veins, we talked about hemorrhoids, people who stand a lot of times if they're not standing in one place and they're not moving, that means their muscles are not helping to milk that blood back to the heart, and it can lead to varicose veins. So this is why standing professionals a lot of times will wear support hose. This is also why when people have had surgery, especially if they have been put under general anesthesia, maybe like I know when I had my son, I had a C-section and I had a spinal. I had, after my C-section, they put leg cuffs on me, the ones that blow up with air and then they release and then they blow up. So they squeeze your leg and then they release, and then they squeeze and then they release. The reason why they put leg cuffs on people after surgery is to mimic the action of a muscle that would help to milk the blood back to the heart. Okay. Another thing that helps get blood back to the heart through veins, where the pressure is so low, is breathing. Breathing in and out actually changes the pressure, especially in your ventral body cavities. Now, we know it changes the pressure in the thoracic cavity up here. This is actually what's driving breathing. I know we haven't gotten to the respiratory system yet, so that is what's driving air coming in and air going out. But it's also changing the pressure in the abdominal pelvic cavity. You have a diaphragm, which is basically this thin walled muscle that separates the thoracic cavity from the abdominal pelvic cavity. When you breathe in, the diaphragm contracts and moves down. So you actually have less space down here in the abdominal pelvic cavity when you take a breath in. That's going to increase the pressure down here, right? Your diaphragm's pushing down on all these organs. So that pressure change can also help to milk that blood back towards the heart. That pressure change also can help you get things out of your body. This is why when women go into labor, they'll say, take a deep breath and hold it and push. You are taking a big breath in so that you're increasing the pressure down here to help get the baby out. So those pressure changes are also helping to move blood. And then lastly is venoconstriction. This is just muscles in the veins that are constricting the veins and helping to milk that blood back towards the heart. So this is an example of some of your muscles as like a muscular pump. So you can see here, like as this muscle were to contract, that vein is going to get squeezed on and it's just going to help to move the blood back towards the heart.